Good afternoon. This is Nancy Anderson with SMI. We are going to be starting our webinar in just a minute. Thank you for your patience. Good afternoon. This is Nancy Anderson from SMI, and I'd like to welcome you to this very first in a series of huddle calls for our SMI members during these really challenging times. First, I'd like to say thank you to all of you who are on the front lines working so hard to help healthcare deal with this crisis. And thank you for joining the call today. This series of calls is designed to be an opportunity for SMI members to share insights and ideas about the current crisis and work together to look for solutions we can all use to address the issues we are facing. We're recording these calls so that all members will have access to them, even those who aren't able to participate today, and we will be taking and sharing notes from each call as well. In fact, we will have a note-taking live on the screen so you can make sure that your ideas and thoughts are captured. We currently have all participants on mute so that we can complete our opening remarks. And then once our speaker, Li Ern, finishes some brief comments, we will open the lines to discussion via audio and via the chat feature. Please note that you will need to unmute your individual line to participate in the audio discussion. So we will unmute the master switch, and then you'll also need to unmute your individual line. When you need to participate in the audio discussion, please announce your name. And to keep the background noise to a minimum, please keep yourself on mute during the discussion unless you are speaking. So, without any further delay, I would like to introduce and welcome Dr. Li Ern Chen, who will make a few remarks today and then will lead us in a discussion based on the blog that she published for SMI last week. Li Ern, I think many of you know her as an esteemed physician who has rapidly become a leading clinical voice in the healthcare supply chain. She is currently a strategic advisor to SMI, working with our Clinical Integration Initiative team, and we're delighted to have her here. Li Ern, welcome.
Thanks so much, Nancy. Honored to be here, and thank you all for taking a few minutes out of your very, very busy day to be with us and to be with the SMI community. I assume you've read the blog, which led you to the registration for the webinar, so I don't want to be repetitive, and I'll just take the first couple of minutes before we launch into a discussion with everyone on the call to go through a couple of thoughts beyond the immediate PPE scramble that everybody is seeing right now. And the general concept is we know that there are more shortages coming beyond just the PPE, and everyone's got PPE strategies going right now, new ones coming up every day, and we can certainly discuss those on this call in a couple of minutes. But two things that I wanted to mention, one directed to the provider side, and really one also directed to the supplier side, right? So we've got both providers and suppliers on the call today. For the providers, it's really, really important to talk to the clinicians right now and be visible and understand what they are dealing with, right? And I'm not asking you to put you or your team at risk, right, of exposure, but rather to understand what the caregiver's pain points are, be a listening ear so that you may uncover new needs that you are not currently anticipating. I was on a ARM board call yesterday, and many leaders were lamenting the things that they're running into now, that they're running short of, that they didn't think of. They're not PPE, but things that they really didn't think of, like 10-foot IV lines, because hospitals are setting up their patient beds for COVID-19 patients with the IV pumps outside the room, so the nurses don't have to gown up and use all the PPE to adjust the IV pumps or change medications. So they're running short of 10-foot long IV lines. So there are things that you and your team might learn by just kind of gemba walking or having close communication with the people on the ground taking care of the COVID-19 and other patients. Then secondly, on the topic of what's going to happen after this immediate mad rush for PPE and a big bolus of COVID-19 patients coming into our hospitals, eventually we're going to get back to doing all the elective work that we're used to doing at baseline. However, as we know, based on worldwide manufacturing shutdowns, we are going to run short of certain supplies, and it's going to take a while for the supply chain to catch up and get back to quote unquote normal or its new normal. And so I'd love to hear from the suppliers on this call how you're mapping your supply chains back to their origin. Are you developing lists and sort of Gantt charts, right, of current and anticipated shortages of your different products and product lines? How long you're expecting those to be down for, and then how do we connect that information to the clinical side, to the providers and the supply chain organizations, to the clinicians, to make sure that they're planning out their procedures appropriately. We don't want people using all the quote unquote stuff on elective procedures, so then when an emergency comes in, they're out. So I think there's a lot of planning that can go on now. And while many clinicians seem to be in a frenzy, I'll tell you from personal experience, there are a lot of people who generally do elective things who are sitting around doing absolutely nothing and can help with this, with the initiative to plan for post-COVID-19. So those are my remarks. And I think we can open it up to discussion with the group. It looks like we've got 26 people on the call, so that's a great number.
Christine, have you opened up the audio so that everyone can participate?
I have, yes, Nancy. So we've just unmuted everyone's line, and just a reminder, everyone, if they want to speak, they'll need to individually unmute their own lines.
And Christine's got just a discussion, a notes list that we can start taking notes, and then we will again share these notes out with the entire membership after our call today.
So Nancy, Susan Schutte would like to comment. Go ahead, Susan.
Sure.
Susan, are you on mute?
Susan?
Yes, this is Susan. I did not have a comment.
Oh.
Okay, sorry. I saw your hand raised. I'm sorry.
Oh, no,
So
no,
I guess
that's fine.
I'll pose a question. You know, so we'll start with the provider organizations on the call. What are you doing and with your clinicians right now? Have you come up with any sort of unique ways of engaging, things that you've done that have been extraordinarily successful for you that you can share with your SMI colleagues, or unique community efforts that have benefited you and your clinicians that you can share that other SMI members might be able to use in their communities as well? So I'll throw one out.
Amanda Chawla was out there, right?
Thank you, Amanda.
Amanda, are you out there? Yeah, I think Amanda Chawla was out there. Amanda, I don't know if you have some thoughts to share with the group on what you're doing out at Stanford. I think you're doing some pretty, I've heard tell that you're doing some pretty unique stuff out there. Are you on mute, Amanda? Sorry, Li Ern, I interrupted you. Go ahead.
Oh, no, that's okay. I was going to just throw out a couple from here in St. Louis. So one thing is, you know, all the schools are closed. And so the schools have been gathering their supplies, right? Be they masks, gloves, cleaning agents, hand sanitizer that they had stocked up on before school closed, and donating those to the hospitals and health systems. And those have been obviously very well received. The other thing that's, I don't think it's happened yet, but they're figuring out how to do it, is coming up with a single collection point in the city for all donations to make it just easy to donate, but then letting the hospitals have access to that and going to pick up. So just some sort of very baseline community efforts that are going on out there, but can be helpful if your community has not done that.
Hey, Li Ern, this is Karen.
Hi, Karen.
Hi there. I can just offer a few things. I just literally got off a call and was talking to a number of providers on things that they were doing. And so I'll just throw these out in case they generate some other ideas or even disagreement. So one of the things is kind of an identified need for, as they're looking for products that are not normally used, is this access, particularly for instructions for use, electronic instructions for use, that we could be including as a hyperlink, because, you know, you think about something like, you know, a safety syringe, you know, different brands have different mechanisms that you need to, and things you need to do to put in place to do this. So how do we, as we're starting to find different products, you know, that people could say, well, if I can't get this, I could get that, and here's a different supplier, but you need to provide that information, you know, front and center for those, for the clinicians who might not be used to using that. Some discussions with some other suppliers, supply chain folks, talking to their clinicians, and particularly starting to have some interesting conversations about appropriate use, utilization, you know, conservation, less waste, those kinds of things. And then let's see, what was the other? I've completely forgotten. I can't read my notes. Is what it is. But those are a couple of things. Oh, and then the other
Karen,
is, yes.
No, I believe, am I correct that the Lumiere data that was recently released also has a lot of information on various products that fit into specific categories that might provide this same information you're talking about in terms of hyperlinks?
We do have, so a lot of Lumiere's, you know, clinically relevant attributes, if you will, that kind of data comes from the instructions for use. And so we actually were literally having another conversation in terms of how could we make that more available, because we've been pulling data from the exchange, you know, data from some of our other tools to identify different products, or the data by which, you know, it's really not us to decide it should be this or that, but it's getting that information out to the providers. But we were just talking about the fact that we should really be adding that since we have that availability. And, you know, I think that instructions for you and kind of forward as well. The other thing is, you know, we've been building out different of products as different shortages are coming up. And I think it's important for us to be thinking, you know, beyond PPE. An example, I was talking to somebody yesterday, and it's like, you know, we talk a lot about the ventilators. Well, what about the disposables that go with, or the consumables that go with ventilators? You know, people starting to run out of HEPA filters and those kinds of things. And as we look at the progression of the disease, as we look at changing protocols for the use of products, you know, starting to identify those people who are at the epicenter right now, there is, you know, they're in crisis mode. But are there real-time learnings that we can start providing to other providers who are still in the path, if you will? You know, and in particular, you know, Li Ern and I were talking with Tom from BJC via email this morning, you know, and how can we get providers kind of working with other providers in the same community? You know, so we're preparing as teams, as opposed to every organization trying to do it by themselves, because I think that can be counterproductive.
Thank you, Karen. And yeah, your point about, what are the currently unthought of disposables and consumables that are going to be short in the near future. I'm going to take that and kind of go off on a tangent and talk about, what other supplies that we can really prepare for now, right? Going back to the elective surgery, and I know that no one wants to talk about elective surgery right now, but it's all everyone is going to want to talk about once this is over, because that's what's going to generate revenue for the hospitals. And how do we ensure supply continuity for that, and matching demand and supply when we get to that point, which, hopefully the sooner the better. So let me, I know Laura Latham's on the call. Laura, do you mind if I ask you to share, what Stryker's response has been in terms of trying to understand, what's going on with your supply chain, and how that's going to impact being able to supply your customers with what they need once this sort of panic mode is over?
Yeah, hi, Li Ern. Thanks for the question. As you can imagine, and I'm sure that all suppliers are doing the same thing, we've done extensive analysis and to some extent had a head start on this, just given that there were lots of questions coming from the provider community initially when there was major concern about supply disruption with the virus starting in Wuhan. So I think, that was the first thing we did as an organization, was to really understand, both from a primary supply, which for Stryker in particular, it's not a major concern, but also our secondary suppliers, and really started going back to tier 1 and tier 2 to understand what that potential disruption might look like. So I feel really confident that we have really good visibility to what that is, and that the team is all over planning and understanding. I think one of the realities is that some of the decisions that we're making as an organization right now is to prioritize those product lines that are under current demand. So we are sort of flexing to overproduce, if you will, in some of those product lines where there is great demand, and seeing what we can do to accelerate production there, which does mean slowing down or flexing production in other areas. I think in our world, we have a lot of inventory. A lot of it is in your hospitals. When you think about joint replacement or spine or some of the implantables that are in our space, that obviously is a major impact that we're feeling right along with the provider customers as it relates to significant drop off of that volume. So we don't anticipate that there will be, any inventory concerns once that volume comes back. Because really a lot of that inventory is already there and in existence, but it's something that we're being mindful of. I think the other thing that many manufacturers are evaluating, and Stryker's among this, is any of those product lines where we've actually had back order situations or our supply health hasn't been very good. We are trying to look at this opportunity to actually recover from that. So when those types of procedures are back under demand, we actually have better availability to supply than maybe we had prior. So I don't know if that addresses your question exactly, but I hope our provider community can feel confident that our teams are heavily invested in ensuring that we are ready to ramp right back up with them.
That's great. No, it sounds like you guys are doing a lot, and I'm sure many suppliers are. Are you? How are you engaging with the provider side, or who are you engaging with, right? Because they're all distracted right now, as we know.
Yeah.
To make sure that they know, right? That you're doing, quote unquote, all the right things, and having that conversation to make sure their demand is going to meet, or your supply is going to meet their demand.
I think very frankly, we're trying to stay out of the way of the providers right now. I would say our instruction to our sales teams is you follow the lead of your customer, and if reached out to, then you respond. My team from a corporate level, of course, is getting most of those interactions and engagements, and it tends to generally be specific to the supply components or the product categories that are of most immediate demand for right now. I don't know that we have engaged beyond that with our customers specifically. I think it's interesting that you say that there is a population of clinicians who may be available to do that. I certainly have a population of elective surgery people that are available to do that too. So I think that would be an interesting suggestion, and I would really volunteer to be part of that dialogue if there's any provider organization that wants to engage with that specifically.
I think, Laura, for example, I don't think the spine surgeons are doing a whole heck of a lot right now.
Nor are the joint replacement surgeons.
You got it.
Yeah.
All the hernia repair guys aren't doing anything either.
Yeah.
So,
No, I think it's an important challenge.
Li Ern, we have a couple of comments. I think, Christine, there's a comment from Kevin McMullen.
fantastic.
Yes.
If you can share that with the group.
Yep. Go ahead, Kevin.
Yes, can you hear me? Can you hear me?
Yep.
Yes, we can
hear you.
can.
Yep.
Okay, very good. So our business, Steris Instrument Management Services, one of our key areas that we service are the instrument trays that are used in each and every surgery. And as you all know, there could be 20 of them. One of the challenges that our customers have is that during normal times, the volume is so high on the usage of those trays that they can never be serviced. They just can't take them out of circulation in order to have proper maintenance done. So that leads to surgeon dissatisfaction. It leads to potentially using instruments that are pitted or cracked, which has a cross-contamination infection prevention challenge there also. So during this time of very few elective surgeries, what we're finding is the provider side is coming to us and asking us, now is a good time to be able to service those trays so that when the pent-up demand comes back and elective surgeries are being done again in the hospitals or in the surgery centers, that the instrument sets are fully functional, because the demand is going to be, I think we all know it's going to be very, very high. So to minimize disruptions and surgeon dissatisfaction, that's one of the things that we're working with our customers on, and they simply have to bring the trays to the loading dock where our on-site vans then pick them up and refurbish them at that point. And it seems to be something that our customers are taking advantage of.
Kevin, thank you for sharing that. I mean, that's brilliant, right? I mean, that applies to all kinds of maintenance scopes and everything else. And so thank you for bringing that up. I'm sure that if anyone on the call hasn't thought of that from the provider end, I'm sure that's a helpful tip.
Hey, Li Ern,
Li
it's
Ern, we've
Karen.
got Larry Dooley, who's got some comments to make.
Sorry.
Yeah, good afternoon, everybody. And this is my disclaimer here. This is totally unrelated to Stryker at all. This is just general industry data that I was given access to the other day of what's going on in China as far as returning to production resumption. And I thought it'd be interesting to share with the group here that, again, this is data that's been collected primarily by the financial markets to understand what the impact's going to be and what is the impact going forward. So as of right now, there's a 90% resumption rate of enterprises above $3 million in size. So that's a significant increase in business. Now, again, this is industry-wide, not specific to healthcare. This is just industry-wide. You have 60% resumption of the small and medium-sized enterprises. And again, both of those statistics are outside of Hubei. Hubei is the province of where Wuhan is. And so this is the entire Chinese market outside of that one area. Coal consumption is at 78% of prior year levels. And 80% of the workers have returned to work outside of Hubei. And again, so if you're looking at the resumption rate 2 weeks ago, overall resumption rate was at 75%. Today it's at 85%. Capacity as utilization was at 60%. Now it's at 70%. So what we're seeing is somewhat return to normalcy in the manufacturing areas of China. And again, I don't want anybody to misconstrue this as other than general, all industries, not just healthcare. This is just all industries, and it does exclude the Wuhan area because that is still under lock and key for all practical purposes. But I thought that'd be interesting to have people understand that, you know, China shut down pretty much mid-January. Here it is mid-March. So about 2 months later, they're starting to return to some normalcy in production. The other thought I had, a question I had was, you had mentioned other shortages that aren't here today, but are coming. And I know Laura touched on those, and Kevin touched on it. I know we are preparing. I'm on the spine side. We're heading into our busy season. Our busy season really runs from when school is out through late August, as most of the SCOLI patients are children, and they have their work done in the summer months to recover for school. So we are preparing for that. Obviously, the season's going to be delayed and pushed further into the summer with what's going on now, but we are busily getting ready for that, and also using this opportunity, as Kevin stated, to get ready to go back to full production once elective surgeries come off hold. So I just wanted to share that information with you.
Great, thanks very much, Larry. You know, those numbers are very encouraging, right? Restoring continuity to the supply chain is very important. Does anyone on the call, and Larry, obviously you too, do you have a sense of what's going on with some of the smaller companies and if they're going to be able to come back online? And if they don't, right, how can others, you know, larger companies sort of compensate for that? Does anyone have any sort of intel, thoughts, opinions about that?
I'm sorry, go ahead.
Well, I just was going to offer that I think just general awareness is that large or small, and obviously large companies that have a deeper balance sheet are going to be able to weather this a little bit more, but cash is going to be a major issue for everybody. I think it's really important that we recognize that the cash that's generated for hospitals with elective procedures is the same cash that's generated for suppliers with elective procedures. So depending on what your product mix is going to be, it depends on kind of how heavily impacted you're going to be. So an organization like ours, which relies heavily on the volume of elective procedures, we are going to have a cash challenge the same way our customers are going to have a cash challenge. And so my sense is, I don't have an answer to your question, Li Ern, but just in terms of context, smaller suppliers that rely heavily on spending cash from elective procedures are really going to have a tough time weathering this. And the reality is large suppliers are in the same boat and not in a position to, we don't have free cash. So it's not like we can acquire them to help them. It's not like we can't, right? So there are, that is probably my greatest, one of the greatest concerns of our industry right now. Even if you take it down to a local level, you think about the small businesses that exist within your own community, the landscape after this is going to be really challenged for them. Despite the stimulus package and the package that comes, I think our landscape is going to be different, and it's something we all have to be mindful of.
Yeah, no, thank you, Laura.
I'm sorry, the other piece.
Go ahead, Larry.
To add on to Laura's comments. So on the spine side, which is a very unique business in that there are many, 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 many small suppliers, where you have 8 or 9 suppliers who have maybe 95 to 98% of the market share, and you have another 70, 80 suppliers, trying to survive in that, 3 or 4% market share that's left over. So to Laura's point, Stryker's, is a large company and with a healthy balance sheet and will survive this as well as, as J&J and all the other large companies. But we see in our area in the spine, we do see some fallout from these very small companies that are, are hanging in there, and we don't know how long they're going to be able to hang in there without revenue. What I'm projecting is that, to Lara's point, I think the larger companies like us and J&J and Boston Scientific and Abbott and Baxter are going to use their money to stay healthy themselves without acquiring people. But I think what you're going to see is private equity come in and start, ground feeding off of a lot of these small companies and see what's going. That could have, because there's a lot of money out there in the marketplace, regardless of what's happened to the stock market over the last week, 2 weeks.
Yeah.
There's still a ton of money out there, and so I think you keep your eye on private equity and what's going to happen, what they're going to do in the marketplace, because elective surgery is profitable for the hospitals. It's also profitable for the suppliers. So it will be interesting to see what happens with private, how they behave in the marketplace.
Yeah, thanks for that, Larry and Laura. Let me take those, what Larry and Laura said, and put them into a very concrete to do, right, or recommendation.
Li Ern, can I interrupt?
Yes, absolutely. Go ahead, Nancy.
No, go ahead. No, go ahead. Go ahead, Li Ern.
Oh, okay. So I was just going to say a very practical follow-on, I guess, task from what Larry and Laura both said was, for the provider organizations at this juncture, again, since all their elective folks are literally sitting around, having them identify the products that they use that currently come from small companies, right, that may be threatened by this whole, the company viability, the product viability might be threatened. And so, going to them and saying, if this cannot be available in the future, what can we use instead? And trying to get ahead of that problem today, rather than when they've ramped back up all their elective stuff and then running out of it, on a Monday morning. That may be something that you can put your elective workforce to task doing. Sorry, Nancy, I interrupted you.
That's okay. I just want to be sensitive to the time and let everyone know that we know it is 3:30 Central Time, 4:30 Eastern. And we, the SMI team with Li Ern, can stay on this call for quite a bit longer. But I did want to thank anybody who needs to get off the call now for joining the call. We will be having these calls every Thursday at 3 o'clock Central, 4 o'clock Eastern. We're also starting an online community, so watch for that. And please give us any feedback on what we can do to make these calls more productive. Add other values that would be helpful for you. Let us know what SMI can do to help be part of solving this problem with you. I'd like to turn it back over to some folks that are trying to get some comments in. Karen Conway, I think you had another comment to share. And then Joe Walsh and Bonnie Dewaskin also wanted to share some ideas.
Thank you. I just have a question that we can be addressing perhaps in the supply continuity group. I want to, Laura, thank you for referencing the need to be, mapping supply chain up to tier 1 and tier 2 and tier 3 suppliers. One of the things I'm interested in is, as we start to do that, to identify where there is risk when multiple vendors at the primary level are dependent upon the same vendor upstream. So what they call the diamond supply chain, where it's like, we might be having multiple direct vendors that are available for different products, but they're all dependent upon the same. And if something happens with that particular vendor, I'm not asking for any kind of answer right now, but I think it's something that perhaps we could be pursuing with our supply continuity. And maybe that's something that's already being done. I just don't know how it works.
Thank you, Karen. And John Lebowitz, who's helping to lead that team, is on the call today. So he heard your comments.
Excellent. Thank you.
Joe, did you have some comments to share?
Yeah, it's kind of related, maybe to build on what Karen just said, right? We'll call that maybe the secondary shortages that are building in our healthcare supply chain right now. Some might be related to this kind of like this work that's being shifted to a later time period, like elective surgeries, but some might be related to, production shortages and production shutdowns that are creating shortages. And what I'm really curious about is we've talked about, some specific supplier response to it, but what I'm hearing from a lot of providers is they'd love to know where can they go as a source of information to find out what those secondary shortages are going to be, even just from an information standpoint, so they know what they need to start paying attention to. And is there some, like, referenceable place that they can go to say, oh, I'm going to be short on products X, Y, and Z 2 months from now because this manufacturing plant in China was shut down? And I'm just curious whether it's John or SMI or somebody, if there's some place that we can kind of refer the providers to say, this is the source that you should probably consider going to that would actually help you, really understand what's coming next.
Joe, I wonder if AdvaMed might be a source. I'll work with John on seeing if we can connect with them and see if they might have some information as the representatives of kind of the manufacturer community.
Okay.
That's a great point, Joe. And also, so John Leibowitz and I were talking this morning, and John, I know you're on the call. You mentioned that Resolink is also, obviously involved in that, in the mapping. And so I wonder if that would be an additional resource we might be able to tap into to help us with that effort.
Possibly, yes. And that's something I'll take it on me with Nancy about and see what our next steps would be. But Resolink's also, and we're about to send out an email about it, I think Friday or Monday, offering an exchange program.
John, your audio is pretty bumpy. It might be the system. Can everyone hear me? Or did we lose audio?
I can hear you.
Christine, can you hear me?
I can hear you, Nancy, but it's choppy.
I can, but it's very, very choppy, but
yeah, I think we're
to the audio that they're experiencing very, very high volumes in the audio system. So
right. I think given the technology, Christine, if you want to just write something on your page there that let everyone know that we're going to close the event due to technology
I think
problems.
we're back.
Yeah. Are we?
Great idea.
Is it better? Can you hear me? This is the wonders of modern technology.
I see people are starting to follow. It's
I
choppy.
think our audio quality has deteriorated significantly, so I'm going to recommend that we.
So Christine, if you just want to type something,
I think I'm going to recommend that we end this call. We will restart the conversation next week, and we really appreciate everyone's participation. Thank you for your patience. Yep. I'm see if I can get Christine to put something up.
All right. Thank you, everybody. We'll see you on the next call. If you have feedback or suggestions, please send us. Yeah.
Yeah.
Please send suggestions to us. I don't know if
Thank you.
can hear us.